Normally, we'd be doing this in 2020, and we'd be doing it in a really nice restaurant with food and drink and music and really amazing people from the world of dentistry and beyond, talking about how they're bringing teledentistry to help patient care, help providers communicate, and really do some amazing things with this technology. But, thanks to 2020, we're doing this virtually, so enjoy your pajamas, your sweatpants, relax at home. If you were invited and you got a little bottle of champagne and a mouthwash champagne flute, feel free to enjoy, crack it open, and spend some time with us, watch some interviews with the great winners. We have traditionally had 3 categories for the Innovation Awards, the Teledentistry Awards, and they are a dentist, a hygienist, and an oral health program. This year, because of the pandemic, we added a COVID-19 response category for providers and for an oral health program. So I'm really excited for you to learn more about these programs. The winners for these categories, for the Teledentistry Innovation for a dentist, the winner this year is Dr. Scott Howell. Dr. Scott Howell is the Director of Public Health, Dentistry, and Teledentistry at A.T. Still University in Arizona. He has done great things implementing teledentistry into curriculum so that more students are aware of this and how they can come out of school with this implemented into their practices. He's made connections into a lot of community outreach programs that are really getting access to care at an earlier place. They're doing programs which connect physicians to dental care to help patients address issues earlier. We're also doing a lot in what Scott's doing is helping educate providers across the board on best practices for teledentistry, how to capture images, how to conduct an examination via a virtual consultation. So really great things. Congratulations, Scott. The hygienist who won the award is Jingjing Quan, and she's instrumental as part of the Your Special Smiles program in bringing teledentistry and oral health care improvements to residents of a long-term care facility. So they already had a great program in place, working with Dr. Brooke Fukuoka, where they were bringing in mobile care to help with prevention and maintaining oral health. What Jingjing did in an amazing way during the pandemic was really empowering the care providers at the long-term care facility to be that front line of preventive care support while also getting access to the hygiene team and the dental team to provide additional care and the ability to address issues earlier. The oral health program winner is the University of Rochester Eastman Institute for Oral Health. If you've read studies on teledentistry, a lot of them have come from the team at University of Rochester. They've implemented programs for support with some FQHCs. They continue to expand programs that are reaching out into the community, documenting clinical cases, communication and collaboration between providers, between the community, saving patients time. It's a really innovative program. I think you're going to really enjoy learning more about that. On the COVID-19 awards, we're giving the Provider Award to Dr. Barry Raphael out of New Jersey. He's a really innovative orthodontic practice, and he was able, with his team, to help really adapt very quickly to how COVID was impacting their patients' ability to come into the offices. So using a range of tools, implemented pre-appointment consultations, evaluations, check-ins during treatment of the current patients and their orthodontic treatment, delivery or pickups of aligners, whatever it might have been. Dr. Raphael really adapted his business model and his practice approach to be more convenient for patients and help them out and stay connected to them during the pandemic. And finally, for a COVID-19 program, the award went to Advantage Dental, which is a dental group owned by DentaQuest. And Advantage Dental implemented a range of patient-facing teledentistry approaches and solutions that really helped identify issues earlier in the disease process, also helped patients respond to emergencies and the need for an immediate consultation with their team of dentists who could help identify, triage those issues, and more effectively streamline their care if they needed to come in, or help them avoid an appointment and make it safer and more convenient for everyone involved. So really cool interviews you're going to see. Thank you so much for taking the time to join us. You can watch the whole live event. We're going to keep this page up so you can spend some time later watching individual interviews. Let us know what you think. The 2021 awards, we're going to start accepting nominations for shortly. Thank you for everyone and their persistence and flexibility and really opening the adoption of teledentistry during what was a crazy year of 2020, and 2021 shaping up to have its own level of excitement and interest. So open your bottle of champagne, relax, enjoy some time with your monitor, which I'm sure you haven't done this year and last year. And thank you so much. We look forward to seeing you in person at next year's Telly Awards.
Hello and welcome to the Teledentistry Telly Awards. I want to welcome Dr. Scott Howe. Congratulations on being awarded the Telly Award for 2020.
Thank you so much, Michelle. I really appreciate it. It was quite an honor.
Well, that's awesome. We would love to hear more about your program.
Sure. So we started back in 2015. We've been going for about five years now at A.T. Still University, Arizona School of Dentistry and Oral Health. And I was hired along with my dental hygiene colleague to start the teledentistry program in an academic setting. So we had to come up with courses to teach our students. And then we also wanted to have some clinical scenarios, clinical settings that we would be working in. And I'll be totally honest, the night before my interview, I was looking up the word teledentistry because I had no clue what I was applying for. I was invited by our former dean to apply for this job. And I said, sure, that sounds amazing. And yet I really didn't know what I was doing. But needless to say, here we are almost 5.5 years later. And I think I figured it out. So we work with various community partners. We train second, third, and fourth year students on the ins and outs of teledentistry, from how to use cameras to how to work as a team. Our community partners include kids in juvenile detention, adults in reentry programs, and low-income seniors, just to name a few. And unfortunately, due to COVID, things are a little bit slow right now, but we're looking forward to getting back out there once we're able to work with our partners, because so many of them are high-risk populations. We've had to slow down a bit over the past couple months.
I can imagine. However, you had such a beautiful foundation in teledentistry that you could, was that able to grow during the pandemic?
As we were exploring how we were going to just run the regular clinic. So the teledentistry program is a bit of an offshoot of what we do at the dental school. It happens within the dental school, but it's sort of its own, we call it like a rotation for our students. But then when things started slowing down with some of our community partners, we began to look at, well, what can we do within the school to use teledentistry to better enhance our workflows, keep patients safe, keep the students, the residents safe. And so we started implementing some teledentistry protocols into our advanced care clinic, and our ACC, we call it for short. And the ACC is where our residents work, our advanced education and general dentistry residents, and that's where our special needs clinic is. And the patients there are very high risk. They are a lot of adults with special needs. There are a lot of adults with complex medical conditions. And then I say high risk for COVID. And then the sort of the non-high risk category of patients that we see are just patients that need much bigger dental, a lot more dental care than would be appropriate for a dental student. So they go to our residents. And we've been implementing that within the ACC. And we got some grant money recently to make that better and improve that system.
What would be maybe the most popular way that you've used teledentistry? Because I was looking and it looked like you're even using it for like post-operative appointments.
You know, I always used to think that asynchronous teledentistry was the only way to do teledentistry because synchronous just didn't make sense to me. It seemed like it was too hard to coordinate the timing and everything. And I think what we've done is that we've taken a little bit of everything and tried to see how it works best in various scenarios. So, you know, yeah, we started with asynchronous, and I think that was prior to COVID, the most popular way, most common way. But then we started doing some synchronous teledentistry. There's a site that I work with where an affiliated practice dental hygienist is treating kids with special needs. And she was using the camera to go around the mouth and show me what was going on while I was sitting here at this computer. We started doing direct-to-consumer, direct-to-patient teledentistry, like doing post-operative visits. And I've talked to patients who have really appreciated not having to drive hours to get to the dental appointment, because we pull from all over Arizona for our patient population, and, you know, for that quick post-op visit or that treatment plan presentation. Does it work always? Not always. You know, there's still technological issues and things like that. It's definitely not perfect. But what I love about being in the academic setting is that we can take that, we can work with it, we can build on it, and we can see what's better for the next round that we work with.
And I can imagine what a benefit is to patients to be able to not have to jump into the car, to feel like you can stay at home and stay safe, but still reach access to care with their dental provider. I think that's amazing.
Yeah, they definitely appreciated it for sure.
Awesome. The other thing that I loved to hear was that you guys are also teaching the students how to be advocates for teledentistry, depending on whatever state they might graduate and go to.
Mm-hmm. Yeah, this sort of has developed over the past couple of years. In terms of our didactic program, we've always had something that was like, here's the base, here are the basics of teledentistry. Here's what the terms are. Here's how you quote unquote do teledentistry. But then as I began seeing teledentistry expand and sort of the misconceptions of what it is and what it can do and what it can't do, I began thinking, well, we are at AT Still University considered one of like a public health oriented dental school. And public health is all about identifying the barriers to care and overcoming them. Well, one of the biggest barriers to teledentistry right now is a lack of legislation and a lack of laws and rules that allow dentists to be able to use this tool to reach their patients. And so we spend some time in the third year, once the students have sort of entered clinic and they've been able to see some patients, and they've been able, some of them, not all of them, have done their rotation where they get to practice using teledentistry. And we use a class where they are put into groups, and as a group, they're given some sort of legal challenge or societal challenge using populations that they would see at the dental school, kids in detention or adults in a rehabilitation program. And they're told to sort of explore, you know, what are the problems and how could you use teledentistry to overcome them? But then they're given, like I said, legal problems. Maybe hygienists aren't allowed to practice under general supervision in their state, or maybe their state doesn't recognize teledentistry at all. And so this past year, I had them come up with a testimony. How would they testify on behalf of teledentistry to their state legislature? Each year I do something a little bit different with the class, but that's what we did this year. And I think the students, from the comments they've given me, is that they're like, wow, I had no idea that, you know, testifying really didn't take a lot of work, but it can have a pretty big impact on the future of whatever issue is on the table. And in this case, it's teledentistry.
Wow, that is fantastic. I am curious, since you've been doing this for a little while, have you had anybody come back after they graduate and say, yes, I'm still using teledentistry in my own practice? Maybe it's private practice, maybe they went into public health, or are they implementing teledentistry at like any level? Maybe it is asynchronous, or maybe it's just maybe for referring to a provider out there. Any thoughts or any stories behind that?
I have had, probably more so in the community health, public health realm, I've had students come back and say, hey, can you help me? I'm trying to get teledentistry up and running at our community health clinic, and I'm not sure about, you know, all the steps, all the things I should consider. Especially, I had several people come from Arizona. I had a student before they graduated come and say, you know, I'm really interested in doing teledentistry when I get back to my home state. And so give that person some tips and suggestions to consider. We get students, I want to say about 60% of our students come from other states outside of Arizona. Now, a lot of students do end up staying here when they graduate, But because of that, it's really hard for me to figure out what exactly is every student going to need to learn. And so when we were developing the course, that's sort of why I shifted to this advocacy and testimony type based education, because when they go back out there, I don't know where they're going to end up. I can't say I've had anyone, I don't recall anyone who's worked in private practice, or I don't think any of my graduates have ended up back in academia quite yet, hopefully one day. But definitely in the community health realm. And it's interesting to see, because I've had people tell me I don't know what teledentistry is. I've had people tell me I do teledentistry the old way. And my perspective on teledentistry is that there is no right or wrong way to connect with your dentist from a distance. There are maybe better ways than others, but when I talk with graduates or people working around the country who just want tips and suggestions, I had the opportunity to talk to someone in Saudi Arabia recently about her developing her program within her academic institution. And my perspective is, use the technology in a way that meets your needs, that allows you to work within your state practice act and with the state laws. If you have to use synchronous teledentistry, there's ways to do it. If you can use asynchronous, or if you can use like a direct to patient approach, there's so many different ways to approach connecting with our patients across distances. And we definitely don't want to limit ourselves within reason, I guess. There's just so many avenues, and I don't think we've explored them all. And COVID taught me that. I thought I knew pretty good sense of what teledentistry looked like, and I learned quite a bit over the last 8 months.
I think a lot of us have learned about a lot of things over the last year, I would even say.
Yeah, it's almost been a year. Yeah.
Isn't that insane? Any other thoughts or comments you want to tell us about your program or the benefits of teledentistry?
I think one thing we are going to have to look at, especially in my world in academia, is, as you asked, have my students come back, or is anyone using it? One thing I do before they graduate, I've been surveying students and asking them, hey, what do you think you're going to do after you leave? And, the majority of them are saying, I think I could do this. But the biggest question they have is, I don't know if I'm going to be allowed to do it. A lot of students are going to they're not opening their own offices. They're coming out of school with hundreds of thousands of dollars of debt. So now's not the time to open an office for most of our graduates, but they're going to work as associates. They're going to work in a corporate setting. They're going to work at a community health center. And they just don't know, will the state laws allow it? Will the clinic director allow it? And it's about teaching people to be advocates wherever they end up. Maybe they need to advocate to their boss. Maybe they need to advocate to their state legislature or their state dental board. And the other thing that I think we need to continue working on, that I see some of our graduates walk away saying, is, I still don't feel comfortable with anyone but the dentist collecting clinical records. They feel they need to be the ones. The dentist needs to be the one with hands-on. I look like I'm choking someone here. I'm not. I'm hands, fingers, and mouths, feeling for those lumps and bumps, feeling for those cavities and things like that. And so there's still some training that needs to be done to help people trust their colleagues, trust their non-dentist colleagues to work together as a team. And I think that's true of students. I think that's true of current providers. And I think it's going to be true, for insurance companies, to help them recognize the strengths of teledentistry, the weaknesses of teledentistry, what we can and can't do, so that we can get reimbursement, because that's another big issue that we're facing. But it's just new opportunities to explore. I'm highlighting these as sort of some of the challenges we face, but I just view them as ways to continue exploring what teledentistry can do and what we can do to improve it. So yeah, they're challenges, but they're not roadblocks.
Oh, well, thank you for all of your hard work and all of your dedication to increase the access to care with teledentistry. And congratulations on your award as well.
Thank you, Michelle. And thank you for the time today.
Yes.
Thanks, Michelle and Dr. Howell. Dr. Howell, really appreciate what you're doing out there and all the lives you're touching and the students that you're introducing to teledentistry. Up next, we've got Jingjing Kwan, and she'll talk to Michelle about her program, along with Dr. Fukuoka, about how Your Special Smiles is really impacting care delivery in an innovative setting, in a long-term care setting, and really helping these patients and residents improve their oral health and maintain their oral health. Here you go.
Okay, welcome. I'm so excited to learn more about our next category and the Tellies Awards. And I want to welcome Dr. Brooke and Jingjing to this interview. Congratulations. And Dr. Brooke, I would love to learn more about why you nominated Jingjing for this category.
Well, excellent. When I looked at the Tellies Awards, I thought, oh my gosh, this is perfect for Jingjing because she's been so incredibly innovative not only during the pandemic but also before the pandemic. So we received a grant for our practice to bring hygienists in and to allow those hygienists to practice teledentistry. And with that grant, I didn't even have hygienists at this point. I was a mobile dentist. I went to nursing homes. I would do the cleanings myself. I would do the treatment myself. And it was all pretty much just me doing that. And when this grant became available, I was like, oh my gosh, this is awesome because I would really like to have hygienists. I just couldn't afford hygienists. And so when the grant came along and made that possible, we started a hygiene program. And Jingjing and her colleague Holly were a very two first hygienists in our entire program. So the two of those girls set up this entire program. They picked out all of our instruments. They put our instruments together, and they really were the foundation for our hygiene program. Well, then when it came to teledentistry, Jingjing stepped up, and she really took a liking to working with students, working with the cameras, gathering teledental information. She was like instantly good at it. She was instantly way better than me at it. I was a little jealous because what took me a long time to learn, she learned like, oh yeah, this is how I do it. She actually trained a student over Teledent. She used the program and she trained a student, and she told the student how to hold the camera differently, and she wasn't even in the room. I was in the room. And I didn't catch that she was holding the camera wrong, but Jingjing caught to tell her to hold the camera differently just from the video she was getting. So Jingjing is super good at this stuff. But when the pandemic hit, Jingjing had all of these different innovative ideas of how we can incorporate teledentistry, and we'll let her talk about some of her ideas. But I just thought she was absolutely perfect for this award because I can't think of anyone who's been more innovative. You know, during this pandemic time, I can't think of anyone that's been more innovative in just making sure that her patient still was able to get care. Yesterday, she came to my house, because I have COVID right now, by the way, which is no fun. But yesterday, she came, she had all of her infection control stuff. We left something out on the stoop. She cleaned it off, picked it up, and she's training some caregivers with some of our stuff. So, and this was her idea. This is originated not from me asking her to do it, but from her saying, well, what if I did that? So that in a nutshell is why I nominated Jingjing for this, because she has really just taken the step. She's come up with great ideas. She's executed these ideas. She's trained students. She's trained caregivers. She's trained me. And so I just think that she is amazing.
Oh, what a great story. I'm so excited to meet you. Congratulations. And thank you for an amazing program that you've put together.
Yeah, I'm kind of very encouraged to get this award, and so thankful Dr. Brooke, because really, actually, I just been in the dental field for a little more than 2 years after graduation, so kind of like new hygienist. But I've been practicing teledentistry for more than 2 years with Dr. Brooke, so kind of very familiar with this field, and also, I want to thank Dr. Brooke because actually she teach me a lot about teledentistry, and that opened a new door to me. Kind of know, oh, actually our dental hygienists not only can serve our patients in the clinic, but also we can serve more patients through teledent. So that's kind of amazing to me. That's why I'm just so into this teledentistry.
Y'all sound like an amazing team.
Yeah. So like Dr. Brooke said, our program before the COVID-19 pandemic, we already involved teledentistry because Dr. Brooke practiced both synchronous and asynchronous teledentistry, and I will just go to our facility to help her do the exam, collect data, and then send those data to her. So, because it's not realistic for doctor go to those facility every time when any patient has any dental needs. It just can be that she don't have that much time and the cost will be huge. But it's very practical for us, like a dental hygiene, dental assistant. We can go to those facilities whenever those patients has needs, and we can collect the data. And even with the teledent, we can train our caregiver to help us to collect the data. So like if one patient has toothache, the caregiver actually guided by us through Teledent can collect those pictures for Dr. Brooke, and she can look at those pictures and say, oh, this is emergency. I need to go to that facility today. Oh, it can wait a little bit. I maybe just prescribe some prescription, sent to the facility. That will be enough. So I think this makes things works better, and our patients' needs will be met. And I think that's wonderful. That's an amazing side for Teledent.
So at what point did you pivot and you're like, I have ideas on how to like really make sure our patients are still being treated?
Yeah, actually, during the pandemic, I see actually that's the idea of Dr. Brooke, because we have a daily oral hygiene program before the pandemic. And then when the pandemic hit, most senior facility shut down, so we can't get in. But those patients still have dental needs, and they are vulnerable. They need a good daily oral care. It can prevent infection. It can prevent a lot of things for them. So they really need that. So we just think, oh, then we need to think a way to make this work. We need to think a way how we can help them with daily oral care. Then it comes a guided oral hygiene program. We just love this. Dr. Brooke, do you want to share some of this?
Sure, yeah. So with the guided oral hygiene program, what we had done is we said, we can't have that assistant. We had an assistant going out into the care facilities and providing the regular oral hygiene. Our assistant that we had was a dental hygiene student, and she would go out 3 days a week, brush, floss, use proxy brushes, do all of the things as guided by the hygienist originally or by myself originally. She would carry out that oral hygiene plan. She basically acted as the patient's hands, because most of our patients can't use their own hands to brush their own teeth, so they need someone else's hands. The caregivers are very busy. They're not really able to do that either, just because of the time crunches they have. So we put this person to be there in charge of actually brushing and flossing. And now this person can't come into the facility anymore because of the pandemic. And so we said, well, let's use our teledentistry, and we'll have our hygienist, someone who's very highly educated in how to provide hygiene services, work with a caregiver, someone who hasn't been educated quite as much in how to provide hygiene services, but they can do this live together. And so in doing that, we used the Teledent program. And the amazing thing was Jingjing was able to train Carolina, and she was able to train Carolina without being in person with her very much. She did take one day where they met in the parking lot, they social distanced, they wore masks, and she showed her a couple of things in person because Carolina's learning style was more conducive to learning with at least one person visit. And that was Jingjing's idea. She said, can I have permission to go and meet with her in the parking lot? I feel like if I can just show her these things, she's just gonna excel. And so it's like, well, yeah, just make sure you know your social distance. And Carolina, they went through all the infection control stuff, and then they met, and Jingjing was absolutely right, because after that, she was just like, oh, it all clicked. And so Jingjing was able to train the caregiver using the Teledent, just using live video, and it was synchronous. What Jingjing does with Carolina is synchronous. What I do is once every 2 months, they actually record those videos and save those videos. These videos aren't always recorded when they're working live. That would take up a ton of memory and for not really a whole lot of purpose. But once every couple months, they actually record those videos, and then they have me watch those videos so that I'm also screening these patients and seeing how it's going. So that's our guided oral hygiene program. Jingjing came up with some caregiver training sheets that she actually hand drew. Because of copyright and stuff, we can't just copy and paste off Google. I learned that the hard way myself, and so I'm not going to let her get into that copyright trouble. So she hand drew all these sheets, and she's taught Carolina buccal and lingual. She's taught her all the dental terminology, and Carolina has really excelled with Jingjing's instruction. She's really taught Carolina to do a great job, and I think Carolina has enjoyed it as well. And so she's been a very valuable member of our team, and I think that Jingjing has helped Carolina become part of our team by all of her teaching.
Yeah. At first, we kind of like worry about how will the caregiver doing, because before we all know that the caregiver play an important role for those residents' health, not only the dental health, but the system, the whole body's health. But after they got some dental care education, some caregivers still hesitate to do those things, to brush their teeth, to help them clean their mouths. It's not only because they don't have time, but I think also they are not very comfortable to do that by themselves, because they are not used to see what happened in the mouth. They are not used to do those things. They worry about if I do wrong, if I get them hurt. And for most residency, because of long time don't get like the proper dental care, their mouth have a lot of problems. You can see inflamed gingiva. You can see rapid caries. So once you just gently touch it, they will feel pain. So they will kind of like scream. So when that happens, the caregiver is scared. They don't know what to do. So I just think by training those caregiver, we also need to kind of like be with them while them doing that and let them be comfortable to do all those things. So that just what happened between me and Carolina. Right now, she feels so comfortable to help those residents. She know what kind of the toothbrush to use, to brush which area. She know if the flosser or the proxy brush, which one is better for that residency, and which one is better for which teeth. So that's kind of amazing. So the caregiver can do a lot of things for us.
Wow. So you sound like such an educator at heart.
Actually, yeah, I believe both Dr. Brooke and we have passion on education and public health.
It does. So my last question for you guys, I'm curious, has anyone what perspective has changed from the caregivers or from the patient now that you are doing teledentistry? I know a lot of us got very comfortable with this video interaction in 2020, but has there been any change in the perspective of like level of care that you're providing?
Do you want to see first, Dr. Brooke?
Sure. Yeah. I feel like at first people are very reluctant with technology, and we had a lot of struggles. And luckily, we started teledentistry before the pandemic. So we didn't have all the stress of the pandemic on top of us, as well as starting the technology. But when we first started, it was rough because we were trying to get Wi-Fi in this long-term care facility. And these aren't people who are gaming and who are appreciative of fast Wi-Fi. You know, these are folks who are not utilizing Wi-Fi on a regular basis. So there's multiple rooms in these facilities that don't have a Wi-Fi connection. And when people already have a little bit of a like negative connotation with technology, as some of our folks do, you know, and then you go in and the technology doesn't work, that's a really big obstacle for us to overcome. And it wasn't our technology, it was the Wi-Fi in some of these places. So we tried multiple things. We tried Wi-Fi amplifiers that you just plug into the wall, like one of those little scent plugins, but it does Wi-Fi instead. No, I'm not very good at technology either, and I'm so grateful I have Jing Jing. I'm so grateful I have my husband, because the two of them get me through technology. I am one of those technology, like, not immediate adopters myself. And so we did all of that Wi-Fi expansion, and it kind of worked and kind of didn't. And then we ended up getting one of those MiFis, you know, the portable internet that you can get through like a phone servicer. And that seemed to do a lot better. But I feel like we did start with 3 caregivers, and only one of the caregivers ended up wanting to stick with us, you know, as we proceeded on. You know, we all met when the pandemic hit, and we said, we're going to be pivoting. These are the things we want to do. We want to make sure everyone on our team is on board. And there were a couple of folks that were not quite as on board. They said, this was really fun. It was educational. We appreciate the opportunity. However, this is not something I want to spend extra time on, because these people were not doing it during their work hours. Carolina comes in 1 hour early to work to do this with us. And she's an independent contractor, and we pay her out of our grant. She's not doing this on the clock with the care facility. And so it was a new job, you know, when they started doing this with us. They were now no longer on the clock with the facility. And so the biggest hesitation I saw with it, I think, was just adopting the new technology. I think the quality of care, it is the number one thing I think that we have done in our practice to improve patient health is the regular oral hygiene, whether it's through our guided oral hygiene program or through the assistant going out and brushing and flossing teeth. Just that regular attention on a regular basis is where I've seen the most improvement in oral health. I'd like to say it was me, but it wasn't me at all. Like, I go out and I do all this fancy dentistry, and what really makes a difference is the person who's out there brushing the teeth. But I would say it's improved a lot. People are real hesitant. I had one phone call that said, she's getting her teeth cleaned how many times? 3 times a week? And I was like, no. She's getting her teeth brushed and flossed. Like, there's not a hygienist out with a scaler and, you know, the little thing that sprays all the water. That's not happening 3 times a week. And then the guardians were more like, oh, okay. So there definitely was hesitation from both the caregivers with the technology aspect and with the families, because it just seems like when you say a hygienist is involved or a dental assistant's involved, they're thinking of like a more extensive thing than what you should be doing on a daily basis. Yeah. So I think those were the bigger resistances. What do you think, Jing Jing?
Yeah, and I just want to add one more is from the patients, because at first most patient has a lot of problem in the mouth, so it's kind of like, because they don't brush very like often, and so there's a lot of problem in their mouth. So once we jump in and we begin to brush for 2 minutes and we floss, their gingiva is inflamed, so they will feel uncomfortable. So they will kind of hesitate at first. But then we learned how to kind of like do this a little bit, one step by one step, you know, not just push too hard. And the caregiver and I kind of like, and the one amazing thing is the caregiver, not like the hygienist, they be with the patients daily and the daily pace. So the patient know them much, much better than us. They trust the caregiver. So that kind of help us a lot. Some patients won't let me to clean their teeth, but they will let Carolina to brush their teeth, to floss their teeth. So that's kind of amazing. So the patient will gradually open their mouth and gradually just willing to do whatever we ask them to do. So that's kind of like feel very good.
Wow, your program sounds amazing. It sounds like you're really helping so many people, especially during a pandemic. So thank you so much. And congratulations on your Tellies Award.
Thank you. And yeah, I got it yesterday. I just want to show you guys. Look at it. Yay. Yes. Thank you so much. This means a lot to me. And I will just try my best to keep doing this and try to get more people to involved and get help by the teledentistry. I think teledentistry will help a lot of people.
I agree. And I have no doubt that you will continue the charge and be the champion in teledentistry. Anything else that maybe I didn't ask or you'd like to tell us about your program? I mean, you've done a wonderful job so far.
Yeah, we just try to, right now, Dr. Brooke also try to get teledentistry going maybe more far, and we try to establish a system, like not only practicing our program, maybe we can help other program kind of do the same thing. We really like the guided oral hygiene thing to help those residents in long living facility. So we want to like build a system so other program, maybe they can use the same data, they can use the same system to kind of like do the same thing and help more people. You can just, Dr. Brooke, you can end your thoughts too.
Well, yeah, and we've been working with the Idaho State University as well, and they are doing a program that's similar but a little bit different to ours, and we're going to gather some data with them, and that's going to start this year, so that we're hoping that we can show it's not going to have a significant number of patients, because we can only take care of the number of patients that we can take care of as a small group, but I think it'll be a small case study like example where we can show the decrease in inflammation, and we're actually going to start getting before pictures at our next facility. That was my biggest mistake, was not getting before pictures at this facility that we're currently working with. But as we move into this new facility, we're going to get before pictures. Jingjing's been working a lot with the hygienist at ISU, and it was actually Jingjing's idea to get some measurable results. I love the way that she thinks, because I'm just thinking of that one patient, and I'm just thinking of what can we do to make this patient better. And Jingjing had this bigger picture idea, and she said, well, how are we going to get measurable results to show that this will actually help people, so that we can show other people and have some kind of numerical value attached to what's happening. And so when she came up with that idea, we actually formed a guided oral hygiene group with ISU, with some of the folks in our Department of Health and Welfare, and we've been working on this together through our grant program to be able to quantify how much of a difference we're making. And that's a lot of that is thanks to Jingjing and thanks to Idaho State University faculty members that are helping us come up with this. And Dr. Paul Glassman's been very instrumental in doing some of these things where we're able to take these photos, and we'll be able to use these photos to make a bigger difference than just for those patients that we're seeing.
Wow. Well, thank you guys again. This has been lovely to learn about your program. I'm really excited to see what comes out, because I too do not think about measurable goals. So people like Jinjin, you are such a blessing to us. So, well, and congratulations again. Thank you all so much for your time today and telling us about your program. And we wish you all the success with your patients.
Thank you, Michelle.
Thank you.
Thank you.
Up next, we've got a great interview with the team over at the University of Rochester Eastman Institute for Oral Health. They are really OGs in this space. They've been doing a lot with teledentistry for a long time, and it's a real honor for us to give them the award and to learn more about the projects that they're working on.
Well, welcome to the interview. I'm so excited to learn more about your program. I mentioned in an effort not to embarrass myself, I will let you guys introduce yourselves and your program.
Yeah, Sean, you want to start?
Sure. So I'm Sean McLaren. I'm a pediatric dentist, and I'm the chair of pediatric dentistry here at the Eastman Institute for Oral Health and the director of our new teledentistry division.
Yeah, hi, I'm Dorota Kopycka-Kędzierawski. I'm helping Sean with the teledentistry. I'm not exactly sure what my official title is, but I think I'm an assistant to him. Otherwise, I'm professor of dentistry and central oral biology at the Eastman Institute for Oral Health at the University of Rochester. So just to give you a little bit of a background, we've been doing teledentistry since 2003. So it's been a long time.
So since you kind of had that as a foundation, you've had teledentistry in your back pocket. What has changed, and why did you have to create, or why did you create this amazing division on teledentistry?
Drew, did you want to start with the history?
Well,
you started.
Yeah, the history was that we started with pediatric dentistry, and we were doing screening of children who otherwise would not have access to dentists, if you will, or never visited a dentist. And unfortunately, we identified a lot of dental disease among those kids. Some of them luckily follow up with treatment, because we created library of images to see after our intervention if they actually went to see a dentist. That was a longitudinal follow-up. So many of those kids came from lower socioeconomic backgrounds, and they were little, yet we found a lot of dental disease. And interestingly enough, we were able to follow them and see if they access care or not. And back then, we used store and forward methodology. Like these days, Sean usually is involved in live video conferencing, but I think teledentistry can be used in both ways. So the reason we expanded, because many people suddenly became interested into it, and we want to make sure we're doing things uniformly. So Sean, you can chip in because you have more information.
So after Dorota started and published a whole bunch of stuff on her program, she worked with Dr. Billings and the Department of Pediatrics over here at the University of Rochester Strong Memorial Hospital. We were contacted by a federally qualified health center that sees a lot of pediatric patients, and they didn't have any pediatric dentists that were able to see the patients they have. So they contacted us in 2010. We started up a synchronous program where a pediatric dentist, it was Jeff Karp, Dr. Karp before me, and now it's me. We kind of use the synchronous model to assess the patient's behavior, to help us kind of gain or gauge what's going to be the best treatment modalities. Is this a child needs to go to the operating room? Is this a child that needs sedation or nitrous oxide? Or is this a child that we can treat in the clinic without it, which is local? From that, we had quite a bit of success with that. We decided to try to roll this out to other divisions. We were kind of working with some of the other chairs here, working with federally qualified health centers. They had a big need for oral surgery patients to be seen. We started rolling all of that out, started trying to develop a little bit of a business plan for that. And then all of a sudden the pandemic hit and everything kind of went into warp speed, trying to make sure that we could still see our patients. We were kind of inundated with emergency patients here in Western New York, upstate New York, because a lot of dentists were shut down. They weren't seeing patients. And a lot of emergencies tended to come here. So we were trying to use teledentistry as a screening process to say, yes, this is something we absolutely need to see today. This is something that we can schedule a walk-in appointment for 2-3 days from now, things like that. We've gotten a ton of buy-in from a lot of the other divisions within the dental center. We've worked with local emergency departments to help alleviate some of their dental cases that come in, especially some more of the rural emergency rooms. We're starting to work with nursing homes so that we can use teledentistry as a screening model, so we can either protect the patients in the nursing home by keeping us out of nursing homes if we don't need to be in there, right, and minimize exposure potentiality, or again, minimize having to bring patients to the dental center that may not need to come to the dental center for something that we can address through a teledental consultation. Mm-hmm. So we've had a lot of buy-in. We plan to continue to expand this into individuals with intellectual and developmental disabilities. We're in talks with some organizations to start with that. We've also talked with some of the local jails and juvenile detention centers. Again, kind of same philosophy to make sure that we can plan as much as we can to limit anything that we can limit. You know, it's awful expensive from a healthcare standpoint to have maybe 2 guards transport an inmate to a dental center if it's something that we can address through teledentistry and be more efficient throughout the entire system.
Yeah, and then to add to it, for example, I'll give you another example, like our colleagues from prosthodontics department, you'll think that they really cannot do anything remotely, but they do, because they have very extensive treatment planning with their patients. And as you can imagine now, we have tons of PPE that we are using on top of the things that we used to use. And patients cannot bring their loved one with them. And many times, as I said, those treatment plans are very extensive and patients need to think about it or need to consult with the family member if they want to go for it or not. So our colleagues from the prosthodontics department decided to start teleconsultations via Zoom, and it works pretty well because they can provide models, they can provide x-rays, they can describe what they're going to do, and I think those are going on really nicely. The other program that is expanded or even started the telehealth consultations would be the orofacial maxillofacial surgery. They're doing a ton of it. My understanding is they do it daily, and patients like the convenience of it. And we don't have any data yet how this is going on in terms of the, following up with appointments, but we're working on it. So that's the beauty of it as well, that we can collect data quickly and see how it's working. But I'm pretty sure that we will have good results soon.
And I agree, Jared. I think what we found here is that it's amazing how receptive different dentists have been to this, to these ideas when they see how it's worked for us and what we're trying to do. So that's you know, it was a much easier kind of sell after the pandemic for them to kind of come on board with this. So we've had really good luck with dentists that we never thought would be interested in doing something like this.
Right. And then the other option that we haven't explored fully would be education done via the telehealth, to combine different platforms and perhaps doing educational sessions with residents or either faculties or private practitioners who would be interested to learn more about things that they cannot do or they would like to be involved. So I think that's a great platform to do that as well.
So I'm curious too, because you had the teledentistry in some areas of the university prior to the pandemic, and now you're using it in so many other ways. Has the patient's perspective changed? Do they feel like they're actually getting better care? Do you feel like they were more tech savvy now in 2020? And what are the patient's perspectives?
My personal opinion is it definitely has become very, a lot of Zoom calls were happening for physician appointments and medical appointments. I think they're definitely very accepting. I don't think there's much of a drop off in the terms of the standard of care. So I don't feel that it's a better thing that we're doing through this, but I think they appreciate it more because, you know, for us in pediatrics here in Rochester, it's nothing for us to have patients driving 3 or 4 or 5 hours away to come see us, to have a consultation, to go to the OR. And by doing a teledental consultation, we can save all that time by doing that over a secure Zoom call or something like that. So I think they're much more appreciative. I don't think there's a drop off in standard at all by doing it this way.
No, I would agree with Sean. And also, you know, we can also do more when they come and see us in person, but many times it's not necessary because we can really assess the patient remotely via using the x-rays what we have already, or via using intraocular cameras, talking to them, explaining things. So I think, but what you were asking, I think the convenience of it, safety for some of the patients, especially older individuals or people who have to drive to see us, I think that's a matter of convenience. And again, we can always, I don't see this as a substitution for in-person visit. I think it's a great adjunct tools that we can use. And I think it's a win-win situation if you use it correctly, basically.
Absolutely.
Oh, amazing. We really appreciate you explaining your program to us, and congratulations on the awards. And we're really just excited to see you guys do more in this industry. Is there anything else that you'd like to tell us about the program before we end?
I think the biggest thing is you can't be afraid. You know, we've been doing this for so long, and just talking with some of our other colleagues, they've brought up stuff that we hadn't thought about. And I think that's the biggest thing is ultimately the patients benefit from this. I think the dentists and the residents that we're training here all benefit from this. I think that's the biggest take-home message is not to be afraid. It's different, it's innovative, but it works. And I think you find a lot of those benefits in areas that we weren't even thinking that we would find initially.
Yeah, I would agree, because some of the dentists, they like to do what they are used to doing. But I think to embrace this, again, it's not a substitution, as I said, but it's an adjunct tool, which really helps patients and us as well as providers. And also be a nice tool to train residents as well. So I would agree, just go for it. And again, there are lots of different things that we can be helpful if people have issues in terms of like, how do I use it? How do I do it? It's not that difficult. Just have to start doing it.
Just jump in.
Yeah.
Jump in. Well, thank you so much. Again, congratulations on the award, and thank you for all of your hard work in this area of dentistry.
Thank you for everything you guys are doing. We really appreciate it.
Yeah, it's a pleasure.
You guys, right? Sorry.
Yeah, no, I'm sorry. It's a pleasure. And again, thank you so much for really nominating us and having us. Thank you.
No, it's our honor. Thank you.
Dr. Barry Raphael of New Jersey, an orthodontist, won our COVID-19 response for a provider. Here's an interview he did with his team with Michelle, and talks about how COVID impacted their practice and how they implemented some teledentistry solutions to stay open and convenient to their patients.
Both. I have Dr. Barry Raphael.
Yep.
Yay. And Sarah Tensa.
Yeah. Hello.
Okay, good. I love to butcher your name, so I'm so glad I got it. And I am very excited to chat with you today and learn more about your program. You guys are the winner for the Telly Award in the COVID provider section, and we're really excited to learn more about you. So welcome.
Thank you.
Thank you. Thank you. You listen, this is a story of necessity is the mother of invention, no doubt. We're an orthodontic practice in Clifton, New Jersey. We've been in practice for over 30 years. About 12 years ago, we made a major shift in our practice. Instead of just looking at crooked teeth as the problem, we started looking at it as the symptom and then looking at the underlying causes. So a good portion of the etiology of malocclusion is behavior. The habits that we pick up from sometimes before birth, at birth, after birth, through early childhood. We now know that we can address a lot of these issues by training. That's not something most orthodontists want to get involved in. We try to eliminate cooperation as much as possible, but we've gone the other way. So our practice now is an integrative practice in the sense that I collaborate with many different practitioners, and that collaboration has to be online too, in order to conveniently communicate. And since COVID and the lockdown, we had to transfer a lot of our efforts online, which include record taking, and you can put up that list if you want. That includes the record taking, the history taking, consultation, gathering of certain records, and putting together of a patient portfolio, which is a significant portion of our philosophy. We also use online for patient check-in and screening, and then what's really become a big part of the practice, and Sarah will tell you about that, is the myofunctional training is now done online. We had built a beautiful space for training myofunctional education, and it looked like a playground. It has kid-friendly things on the wall. It doesn't look like a dental operatory, because that's not the best place to teach. But now we can't use it, and but we found that doing online training has actually been a benefit. We also moved to a cloud-based software and a number of different online utilities that have been helpful.
Wow, that's definitely amazing. And I do have faith that one day your beautiful space for myofunctional therapy will be in use again. I'm really excited for what 2020 was able to provide us as far as the technology and access to care. I'm curious, what was the patient's perception? I mean, it sounds like you were always a little bit more tech savvy on the tech side. So I'm thinking your patients didn't have such a hard transition, but I don't know, how did they do?
Well, there's good news and bad news. Because of the uniqueness of our practice, we do have patients that travel quite a distance. And for them, of course, this has been, wonderful, because to have to travel 2 hours or 3 hours to get to the office, which they have to do on occasion, mostly we can eliminate that by using the online telemedicine piece for the consultations, for training, for gathering records. So that's been terrific. We actually think that the training works better online. Sarah, why don't you tell us a little bit about the training program?
Definitely. So our MyoBrace program, typically when we were in the office, 2019, even early 2020, we had our patients come in for monthly check-ins. And so what that would be is it's about a 15-minute meeting that we have with the kids. We do certain exercises with them, and then, they're on their way and they practice them for the rest of the month until we see them next time. But now with our online program, the convenience of being able to check in with kids who were maybe struggling a little bit with the exercise, or they need a little bit of a boost for compliance or just motivation or things like that, is incredible. I mean, I can check in with patients bi-weekly if they need it. I can check in weekly if they need it. There's no need to hop in the car for half an hour to come to us. The convenience aspect of it has just made a huge difference in the results that we're seeing with the kids.
Yeah, even our training program is video based, so the kids have a copy of the training program that's step by step, exercise by exercise, with questions that are recorded on a cloud platform that we can see. So it's just it's really natural to be able to do it at home, and I think Sarah's right. Being able to see the kids on an as needed basis has really helped us boost the efficacy of the program. Michelle, I can't hear you.
There we go. Is that better?
Yeah.
Okay. Thank you. So for those that really have a hard time seeing dentistry in a way or utilize technology in a specific way, because we are traditionally very hands-on, hands and mouth all the time, right? Do you have any advice for those people who are like, okay, maybe I could step into this role? And I'll put back up on the screen all the other things that you started and how you've moved online. What would you say was maybe like the easiest transition or like a baby step into doing something as amazing as what you're doing?
Easy? I don't know if it's easy. Like I say, necessity was the mother of invention here. We felt because of COVID that we wanted patients to be in our office as short a time as possible.
Right.
And have to come as little as possible. Our ability to see patients has been truncated because even though I have a 5-chair operatory, I only use essentially 2 of the chairs at a time now, one on each end of the operatory, so that we don't have, so that we have social distancing. So it was just finding whatever I don't have to do with my hands, I wanted to find a way to do online. So we have online phone system. We have we're able to do appointments online. The consultations are online. I do all my record keeping online. There's I can show this to you. Show this to you as well. This is a sample portfolio that I put together for every patient that has the SOAP notes, our treatment planning, the collaborative team, the patient history, the sleep inventory, which is also administered online. We have the patients take their own pictures. These are clinically taken, but they'll take their own pictures from home and email them to us. Maybe they're not as good a quality as we would see clinically, but they give me a good idea of what the patient's presenting with. They even do their own videos and posture pictures, and they do have to come into the office for the CBCT, but I break out the images in this portfolio and use it as a presentation for the patient during the online consultation. So they easily get to see, probably more easily get to see, the images that we have, than they would if they were even sitting, sitting at a table, looking at a screen across the table. That does assume that the connection's working well that day. That's not always the case.
Well, I mean, there's always challenges, right? Like patients could get in a car accident on the way to their appointment and not be able to show up. So there's always challenges when we're working with patients. But I'm also curious, like, was this some of the stuff that you were already doing? Like, what level of teledentistry were you practicing before the necessity presented itself?
We were not.
Okay.
We literally were not. I discovered the program that I use simply because I wanted to have something that was HIPAA compliant. And I know Zoom can be, but the particular piece we used was made for telemedicine, and it was easy to sign up for, and we just got started with it. Yeah, when the lockdown first occurred, I immediately knew that even though I wasn't going to be able to see patients, and it turned out, for 2.5 months, that I wanted to be in touch with everybody. I wanted to let them know they were being cared for. So we reached out and set up appointments, and I check in with them and ask them how they were doing with their appliances, and I could check expanders. They'll hold it up to the screen and I can look at it, check to make sure their appliances are comfortable. I couldn't adjust them, obviously, but at least I had a feel for that everybody was, was okay.
Are there any other parts of the program that you would like to brag on for the audience?
Sarah, anything? I mean, there's so many things that we've been doing.
So many new things we've been doing. I mean, you already went over the portfolio a bit, but I think a major piece of what we do is the entire new patient process, other than coming into the office for 20 to 30 minutes for an evaluation with the doctor and the x-rays, is all done remotely now, which for us was a huge shift. I mean, our new patient process, because we're so thorough and we're looking at so many different things that a traditional orthodontist might not be, it used to be a 2-hour appointment. So for us to cut that down, nearly 75% was a major accomplishment. And the results that we're getting, from the patients doing all of the at-home records, I'd say are successful. We're still able to give them a full treatment plan, a full thorough diagnosis. I don't think that you're missing any pieces because now there's been some at-home components.
Wow.
That's right.
Well, I just want to say thank you so much for being innovative, for taking this step in this direction. I'm sure your patients are very grateful for your ability to pivot, as we all have had to find a way to pivot this year or last year. And I just want to also say congratulations on the award. We're really excited to tell everybody about your program.
Well, thank you. And we look forward to learning more about mouthwash.
Wonderful.
Advantage Dental has done really amazing things in rolling out teledentistry to a large number of patients and across a lot of providers in their practices. So spend some time with the team from Advantage and DentaQuest as they talk about their goals with teledentistry implementation and how they rolled it out and what value it brought during COVID, and also the long-term value that they see teledentistry offering their patients and their teams.
Welcome to another Tellies Award. Congratulations to you all and your amazing program. I'm really excited to tell everybody what it's all about. I think we're going to start with Kirill. How are you? And welcome.
Hi, thank you.
And so tell us a little bit about your program and how that all looks for you guys.
Thank you, Michelle. So I'm Kirill Zaidman, Vice President of Innovation at DentaQuest, and we're thrilled to be presented this Tellies Award. We have been looking at teledentistry innovation since 2012 and have invested more than $1.7 million in grants and programs to study the applications of telehealth in dentistry. And when the pandemic hit in 2020, mobilized very quickly to look at the environment around the solutions available, sets of providers that were active in the marketplace, and selected Mouthwatch as our preferred solution to implement because of the breadth of use cases that the technology could apply to, specifically going beyond urgent care, thinking about continuity of care, thinking about getting out into communities where people live that don't have access to clinics or cannot easily get to one, and thinking broadly about collaboration between members of the dental team as well as between dentist and medicine. And so with that solution in mind, we work with the rest of our DentaQuest partners to think about where the technology could be applied more easily and where it would be most useful to our members and to our patients. And so I'm thrilled to have the team here today with us to talk about how we actually brought the technology to life in our clinics.
Awesome. Todd, tell us a little bit about
sure.
the program.
Sure. Thank you. And great segue, Kirill. So my name is Todd Cruz, Executive Vice President at DentaQuest and President of our DentaQuest Care Group. The Care Group operates, 80 practices focused on the provision of dental care to our patients across the country. And, the upshot to telehealth, we've been using telehealth for a couple of years now, but really the Mouthwatch platform allowed us to think about it in a more holistic approach, giving tools to our providers and our offices that allowed us to really reach patients that were in need. And there's no doubt that the pandemic accelerated that need greatly. I was really, as I watched the numbers on a daily basis, I was super excited to see the uptick in the utilization of teledentistry through the Mouthwatch platform. And not only the uptick in the utilization of it, but the adoption of it by both our patients and our practitioners. I think that the pandemic and the Mouthwatch tool only accelerated what should be happening in dentistry anyway, which is the utilization of innovation to reach patients in need, but more importantly, keep patients out of the overall healthcare system when we can. What I think the biggest takeaway from me throughout the last 6 months using this platform is we're able to keep patients out of the ER that have emergent or urgent issues and get them dealt with through the dental team, which is the appropriate way to deal with it as opposed to clogging up the ER system, especially in the middle of a national pandemic. So I'm very pleased with the program, very pleased with the successes we've had to date, and very pleased with the Mouthwatch tool.
Oh, thank you. And I think a lot of us agree. Innovation to stop clogging up a system that is already clogged.
Right.
Who can I call on next?
You can probably go to me next, Michelle.
Randy, that would be great. Welcome.
Thank you. I'm Randy Blue, Vice President of Information Technology for our Care Group in DentaQuest. And my role for this program was as the project owner and technology lead. And as Todd and Kirill have talked about, our primary focus was on increasing access to care. And one of the things we had already started during the pandemic were several hotlines in our states to allow the access to oral health consulting by our providers for those that weren't able to get into our oral health centers. During that period of time, we had a number of closures due to the pandemic numbers, but we wanted to find an alternative to simply having the phones and the hotlines. And based on that direction from both Kirill and Todd, we were able to move forward with Mouthwatch. This was vital for us because it gave us an opportunity to expand our teledentistry model. We've done the asynchronous teledentistry over the years, and that's been successful, but this gave us both synchronous and asynchronous opportunities to deploy the platform. We work on a day-to-day basis in our normal practice management system, Dentrix Enterprise, which is comprehensive and provides all of the things that we need for providing oral health in our oral health centers. However, it doesn't have the video capability that Teledent has. So it was a perfect complement to our existing platform. And the things that we focused on in particular were making sure that the workflows made sense. Let's make sure that this is not simply about the technology, but also about how we provide care, how the practitioners use that care, and how they also specifically manage our patient encounters. So I would love to talk about all the successes, but there's also been a lot of hard work with Charity, with my teams, and with others throughout the company who have really provided a lot of input. Our approach simply was to approach this from a pilot perspective, first in Oregon with a pool of teledocs, and then certainly moving on to some other states, Alabama and Massachusetts. After the pilots, we were able to prioritize some key feature enhancements we wanted to see in Teledent and worked with the MouthWatch team to prioritize those. After 5 releases, we had a stable platform, and that's what we did the planning for with regard to the West. So I think it's been a great success. Certainly, we can talk about some of the numbers, well over 7,000 teledentistry encounters by the time we hit early December, which was well over 500% increase year over year.
Wow. I mean, that sounds amazing. And I'm always inspired to hear how many people you are reaching. So thank you for that recap. Charity?
Thanks, Michelle. So it's been a very interesting experience with implementation of teledentistry. You've heard, like, historically, this has been an enterprise endorsed since 2012. Within my role, we've really been utilizing the implementation of a 24/7 emergency call system for over 25 years. And with COVID, again, that was escalated to where when practices closed down, that we really had to, pivot from that. And from leadership, have that support that you've heard from others, how we really expedited that. Why I feel like this has been a really great aspect is from that clinical perspective. Again, you can hear a lot through a patient through the phone, but an image, speaks 1,000 words. And so when we moved with having the ability to utilize the Teledent platform to have, whether it was a still image or to have that video, it really allowed the providers to see what the patient was experiencing. And I think that the best example came from one of our providers recently, who said that they had initially a phone conversation with a patient who said that she wasn't experiencing any swelling, but when that video interaction came into play, it was evident that the patient, had swelling, and so they were able to, prescribe that antibiotic and then get that patient into appropriate care for ongoing dental treatment. And so I think that our on-call phone and what we tried to do, within our care group practices nationwide, it really has allowed us to kind of expand the care that we're doing for a really vulnerable population in a really interesting and unprecedented time. From a clinical perspective, from a provider lens, again, we always go back to what we're comfortable with. And I think that that's something that as a clinician myself, just trying to think through the workflows and the processes and, being reminded what are the day-to-day operational changes that the incorporation of teledentistry has, and really working with our clinical leadership and the boots on the ground individuals to kind of hear from them and what makes sense to them on how they do it and how they can apply it within their comfort level. you can't underscore the importance of, I think, really like over communicating and re-communicating the same message in multiple ways to have lasting systemic change, which that's what we're trying to do with it, within teledentistry. We want this to be something that's in the forefront of our providers and our practices mind, not just to be to fill the gap when we may have, a pandemic in place or fires that are occurring. We want providers to think like, how can I use this in more of like a teleprevention way? And, really looking at that whole person approach to care. I had one of my fellow colleagues say that, teledentistry is a technology that supports us to triage care, try to help mitigate disease processes and manage healthcare and provide dental treatment. And I think we've really seen that with this implementation, and I just look forward to see how we continue to grow and just implement this into our daily workflow and work with our providers and leadership on what else this can do to, most importantly, provide the best care and improve the oral health of all. And with that, I will turn it back to you, Michelle.
I love the term teleprevention. I think that I want that to be like part of our everyday terminology with our patients. Wouldn't that be so great? So that leaves you, Fred. Oh, can't hear you just yet, Fred.
Yeah, you either got me or the dogs earlier. I don't have a whole lot to add to this. I mean, I think the team that you've talked to has really covered the whole thing. I guess I would just add at DentaQuest, we have a mission to improve the oral health of all. And we do that through Preventistry. And I think teledentistry and what we did in the last 12 months with the team on the call, all the way from the people at DentaQuest all the way through our care group team to the clinicians in the field, have really gotten to experience that teledentistry it checks all the big things that we think of when we think about Preventistry around creating access to care, providing care in partnership with our patients, and at the end of it all, just providing high quality care. So it's exciting to think about what we can do with teledentistry as we go forward and get better at what we're able to do with that platform and explore all the different ways that Todd and Charity and Randy have talked about.
Well, I just want to say thank you so much for all the work that y'all are doing. And I just want to say also thank you or congratulations on the award. It's I have no doubt that you're going to be up for many Tellies awards with all the great things y'all have in place. Is there anything that you want to talk about the program that maybe we didn't cover? I'm always curious about patient perspectives. Have their perceptions of the quality of care changed? Do they feel like you're really answering or providing a level of care that they just weren't able to get before?
Michelle, can I jump in with one thing before the patients? Because to me, it was eye-opening. It's always interesting to learn something you didn't expect to learn. And I think what we saw with 2020 was a challenging year in many ways. We have a lot of practices out on the West Coast, and because of the wildfires out there, we had to shut down and close practices, not only because of the pandemic, but because also the environmental factors. And having had teledentistry in place as a system that we could then revert to, I think made our practices more resilient. And so I think this really, highlights an opportunity that this is implementing telehealth and dentistry is a way for us to make our care not only more accessible and our teams more accessible and more patient-centric, but also to help these practices be more resilient through challenges that we know, but also challenges that we don't. And so I was extremely pleased to see that our teams could, already had protocol in place, systems in place, people knew what to do. And so that's just something I wanted to share that I don't think normally we would have expected, but was a benefit.
I think you bring up a good point. We've shown some serious resilience, and I do love seeing all the people that have pivoted and started using teledentistry And I know that 2020 was a crazy year, and the pandemic is like what's in our brains. But gosh, the wildfires and being on the East Coast, that's not something I even thought about. So thank you for bringing that up as well.
So going back to the patients, super quickly, I guess, we have done some research around patient response to it. And the early research was very positive that over 50%, close to 60%, I think, found benefit in their procedure that through their teledentistry appointment. That the things that they like best about it is they can do it on their time relatively quickly. We were able to get them on schedules, and then they can do it from home. They didn't have to leave the house. They didn't have to leave their cars. They could do it without getting out in the world, especially during the pandemic. And then the other thing is I believe the numbers, and Kirill and Sherry, you can keep me honest on this, but I think 30% or less actually ended up needing in-practice care. So we were able to deal with a lot of issues before they even got to the practice.
Wow, that's amazing. That's incredibly impressive. Well, thank you, everyone, for sharing this information with me. Is there anything else that you would like to add that I didn't ask about?
Probably the one thing I would add, Michelle, and I think everyone else would echo this, is the program isn't just a point of implementing, again, workflows and technology. We're now focused on preventistry, and that includes our strategy around continuing to provide increased access to care, averting and diverting people from emergency rooms, but also being able to learn from the providers as they use this technology and the new workflows so that we can get better at providing the care that patients need. This is also going to be targeted in the coming months to populations that really need this focused oral health care as well. So I think the populations that we want to target include diabetics, pregnant moms, and young people as well. So this is going to be important for us. So again, continuous improvement. We've done well. I'm glad we got the Telly, but we're not done.
Michelle, I just would like to add on to what Fred said earlier. Again, with like you said, we had done some research initially when we pivoted to address the synchronous phone within for COVID. And we had close to 90% indicate that they were generally satisfied with their teledentistry visit. And the key aspect, and this relates to your question about patients as well, is that more than 50% reported that they would have had to travel to another city to seek dental care if it hadn't been for teledentistry. More than 40% would have had to take time off from work. And close to 30% said they would have needed to get in-person childcare. So one, with the pandemic and, caregivers being, working from home, trying to do school, and then also having dental, or being a parent trying to be a school teacher, in addition to other, barriers they may have. This really kind of highlighted how teledentistry can kind of bridge that gap to connect care. So I just wanted to highlight that, because we already know that there are multiple barriers to accessing dental care, and this is a tool that can be utilized for that.
No, thank you. That's absolutely, I'm so excited to hear all of that, and things that we kind of already assumed, right? About coming to the dental office. Well, thank you again. Again, congratulations. I love what you said, Randy, that this is a great award, but you still got work to do, and we're really excited to see what's to come from you all. But thank you.
I hope you had a great time at the Tellies this year. Sorry it wasn't in a cool location, but your house is pretty cool. So hope you enjoyed it. We're looking forward to seeing you next year, or this year, right after the Greater New York meeting, when things are back to a new semblance of normalcy and we can all get together and really celebrate not only the winners of this year, who did a great job and have really done innovative things, but also the 2021 nominees and winners. And we'll see how teledentistry really changes over the coming year and how it gets implemented now that there's a much broader awareness of the importance, the expectations that patients have, and the impressive ways that teledentistry can really connect patients to better dental care. So thanks. Cheers, everyone. Thanks for joining us.